Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Angioedema, and you're looking at its types. So this angioedema, before we start, let's look at what is HAE. So HAE, if you see, it stands for the hereditary angioedema. So it is a hereditary angioedema. Now it is the indirect defect. It is nothing but the indirect defect. And indirect defect, it lies on the gene that is for the C1 esterase. So it is on the C1 esterase, and this is C1 esterase inhibitor. Next is it is autosomal dominant. This is AD, that is autosomal dominant, and the patients have one normal and one abnormal gene. So there is one normal and there is one abnormal gene. Now let's look at each variety. So first we start with the type 1 and 2. So type 1 and 2, there is a recurrent episodic angioedema. There is presence of recurrent. There is recurrent and there is episodic, recurrent episodic angioedema. So the recurrent episodic angioedema and also the abdominal attacks are present. So there is recurrent episodic angioedema and there is abdominal attacks. So abdominal attacks are seen and there is no urticaria. So this is without the urticaria. Next is the onset in childhood or young adult. The onset is in childhood or present in the young adult. And 75% have family history. So 3/4 of them will have the family history. Next is note that the attacks may be estrogen dependent. So we have the attacks, they are estrogen dependent. So they are nothing but estrogen dependent. And in this group as well as in type 3 form. So it is also present in type 3 form. Now let's go in detail about the C4 levels. So there are various factors and columns we need to discuss. So there is C4. So when you look at C4 level, it is usually low. So C4 level is low. And when you look at the C1H, C1 INH function, this is C1 INH function, and this is by the chromogenic acid. So this is also usually low. And when you talk about the C1 INH level, the C1 INH level, this is also low. Next, when you look at the C1Q level, this is normal. Next, let's talk about the type 2. So when you're looking at type 2, it has a low C4 level. Then a low C1 INH function. This is by the chromogenic acid. Next is we look at the C1H level, C1 INH level. So in the C1 INH level, here it is in type 2, it will be normal or it will be high. And talking about the C1Q level, it will be normal. Next we look at the type 3. So how is type 3? The type 3 is where the family history present in most cases. So there is FH. So family history is present in most cases and the onset after childhood. So if you look at the onset, it is after the childhood. And the female patients are predominant and the attacks often appear to be estrogen dependent. So when you look at the female patients, they are predominant and the attacks often appear by estrogen dependent. So the attacks, it appears by the estrogen dependent. Next, what about the C4 levels? The C4 level in this case will be normal. So everything will be normal, all the parameters such as the C4 level, C1 INH function by chromogenic acid, C1 INH level, C1Q level, everything will be normal here. All findings will be normal. This is in type 3 variety. Now we'll move on to the AAE. So what is AAE? AAE stands for the acquired angioedema. So it is a acquired angioedema. So acquired angioedema is a condition not inherited but due to other. So it is a condition. It is not inherited. It is not inherited, but it is due to the other. It is due to the other underlying diseases. So it is due to the underlying diseases. So it is due to the underlying diseases. That is the C1 esterase. That is, it involves the C1 esterase. So it involves the C1 esterase inhibitor and is low due to the consumption. It is low due to consumption. Now let's break into the types. So first we look at the type 1. So this type 1 is the onset age is variable. So when you look at the onset age, it is very variable and the symptoms are same as HAE. So if you look at the symptoms, it is very same like the HAE. There is no family history and may be associated with the underlying lymphoproliferative diseases. So there is no family history and there may be underlying. There is underlying lymphoproliferative diseases. Lymphoproliferative disease. Next, we look at the conditions. So what about the C4 levels? The C4 levels will be usually low and the C1 INH level. This is going to be low as well. Now the C1Q level. What is the C1Q level? C1Q level is also usually low and it also may be normal. Next we move on to the type 2 variety of the AAE. So here in type 2 level. So in terms of type 2 level, the onset at variable age. The onset is at variable age. Onset is at a variable age. And the symptoms, if you see, it is indistinguishable. So symptoms are indistinguishable, and this is indistinguishable from the HAE, and there is no family history, there is no FH family history, and is often associated with the auto antibody that binds to. It is associated with the auto antibody. So it is associated with the auto antibody, and it will be associated with that binds to the C1 INH. So what are the features here? So the features it includes, they are usually low. So the type 2, they become the C4 level is usually low. Then comes the question on the C1 INH. C1 INH. So this function by the chromogenic assay. So this will be also low. Next is the C1Q level. The C1Q level, this will be usually low and may be normal. This is low as well as it may be normal. Next is, this was about the type 1 of the AAE. Now just quickly doing the type 2. This was about type 1. Now when you look at the type 2, it is the C4 level, it is usually low. So the C4 level, it is usually low, and whereas the C1 level in type 1 is low, whereas in type 2, the C1 INH level, this is going to be a normal. This is in type 2. Next, when you look at the C1Q level, the C1Q level is going to be usually low. It is usually low and maybe normal as well. Next is, we move on to the drug-induced angioedema. So there is drug-induced angioedema. So drug-induced angioedema, it is the angioedema that occurs through the allergic mechanism. So angioedema, so it occurs through the allergic. So it is through the allergic mechanism. and then it does not involve the C1. So it does not involve the C1 inhibitors. So there is no involvement of the C1 inhibitors and is low due to the consumption. It is low and this is due to the consumption. Next what we see is the type 1. So this is the drug induced angioedema. So the first variety will be the AC inhibitors. So in terms of AC inhibitors and then the NSAIDs. So these varieties, there is a pseudo-allergic. So there is a pseudo-allergic, by this we mean the NSAIDs, or the non-allergic, non-allergic we mean the AC inhibitors. So what this does is, AC inhibitors. Next, the angioedema, it may start at first. The angioedema, it may start at first. The angioedema, it starts at first and there is acute onset of well demarcated. There will be acute onset and well demarcated subcutaneous non-pitting edema. It will be well demarcated as well as subcutaneous non-pitting edema. Subcutaneous non-pitting edema. And this is of the face and the hands. This is of the face or the hands. Next is what are the features. So when you look at the C1 level, C4 level, C1 INH function by the chromogenic assay as well as C1 INH level. So all these, it becomes normal. So all this is normal. And also the C1Q level, this is also turns out to be normal. Next we look at the angioedema with the urticaria. So we look at the angioedema and this is with the urticaria. So angioedema with the urticaria. So here the angioedema is accompanied by the urticaria and it does not involve the C1 INH. So it does not involve the C1 INH. So let's look at the types. So we look at the allergic AE. So first is the allergic AE. So this allergic AE, there is exposure to the food, venom, latex and drug. So the exposure to the food, there is venom, there is latex, presence of the drug as well as the environmental allergen. Next is it also involves the anaphylaxis. It also involves the anaphylaxis. Next is what are the levels. So when you look at the C4 levels, so first we look at the C4 levels. C4 levels, it may be low or it may be normal. Next is it involves the INH. So C1 INH and this is as per the function of the chromogenic assay. So this is also going to be normal. Next, when you look at the C1Q level, the C1Q level, it may be normal or it may be decreased. So this was about the allergic type. Next we look at the AE with the vasculitis. So AE along with the vasculitis. So here along with the vasculitis, there is a long-standing urticaria. There will be a long-standing urticaria and there is presence of tenderness. So there is plus tenderness. Next is there is vascular damage and it is along with the hypocomplementemic. So there is hypocomplementemic. There is urticarial vasculitis as well as there is a CH50. There will be CH50 and it is usually low. And so are the classical pathway components. So are the classical pathway components. So what are the values here? When you're looking at the values, the C4 level will be normal or it will be low. Next is it will have a similar type as that of the allergy. So it will be again normal. This will be the C1 INH level. Then the C1Q level, it may be normal or decreased. Now let's jump on to the last variety, that can be the idiopathic AE. So what is the idiopathic AE? So idiopathic AE means the frequently chronic and relapsing. So it's frequently chronic and it is relapsing as well. So it often occurs with the urticarial. So it is often occurs with the urticarial. And it consider the test for the chronic urticarial. Consider the test for the chronic urticarial. That is the CD20 3C. So what are the lab findings? Lab finding is C4 will be, the C4 level will be low or normal. Then the C1 INH level as per the assay, that is a chromogenic assay, this will also be low or normal. And then when you look at the C1 INH level alone, this is going to be normal. Then lastly, when you look at the C1Q level, this is going to be normal as well. Whereas in other two cases it was normal or decreased, here it is going to be normal. To learn and grow daily like this, please do subscribe.